Hello and welcome to the third week of the October Action Summit for Women State Legislators. We're so pleased to have you join us. I'm Corey Greer, WAN's Communications Director. Over the past 4 years, I've had the pleasure of working with many of you in the Women Legislators Lobby. I started out at this organization as a coordinator for this very conference. Back then, I was printing name tags, calling many of you on the phone, and booking hotel rooms. But now I get to support you in being the most successful legislators you can be by honing your writing skills to get opinion pieces placed in national outlets, showing you how to leverage Twitter, and teaching you how to create your political brand. But one thing has remained constant: watching you succeed in your campaigns, in passing policy, and just pushing back against the sexism in your home states. That is the highlight of my job. So let's get to it. This week, we have a packed lineup focusing on health security. I don't need to explain to you why this issue is important. It's in every newspaper and every social media feed in America and across the globe. But many of the issues we'll be talking about started long before COVID-19 took over our world. Lack of access to healthcare, a legacy of contamination, and a war on bodily autonomy are interconnected. Housing and job insecurity, paid and unpaid care work, and our nation's resilience and stability. Our speakers this week will discuss these intersections and also give you the tools you need to create sound policy in your state. Today, we'll hear Jackie Ferreira, the Executive Director of the National Women's Health Network. Then our board chair, Charlita Tavares, will sit down with Sarah Rosenbaum, the founding chair of the Department of Health Policy at George Washington University's School of Public Health. On Thursday, Congresswoman Lauren Underwood from Illinois will kick off the day and will be followed by Dr. Helen Caldicott. After that, our advocacy director, Mac Hamilton, will give you a preview of Lobby Day, where you'll be able to meet with your members of Congress alongside WAN staff and board members. You can find a link to sign up in the chat. Our Thursday afternoon panel, Bombs in Our Backyard, will discuss compensation for nuclear harm with Tina Cordova and Susan Gordon. We'll then have 3 different breakout sessions for you to choose from: on-camera interview training, crafting healthcare policy, and Instagram for state legislators. This called Creating an Intersectional Care and Climate Vision. The dinners are always our most loved sessions because they give you a chance to really connect with your fellow legislators. So I highly recommend that you attend. But before all of that, I'd like to introduce you to our first speaker, Celinda Lake, who will be talking about public perception and attitudes around healthcare. Celinda Lake is one of the leading pollsters for the Biden campaign in 2020 and continues to serve as a pollster to the DNC and dozens of Democratic incumbents and challengers at all levels of the electoral process. Linda currently serves as president of Lake Research Partners, and they're known for cutting-edge research on issues including the economy, healthcare, the environment, and education. Polling has helped candidates such as Representative Alexandria Ocasio-Cortez, AOC, as we all know her, Senator John Tester, and former Governor Bob Wise, 2 groundbreaking wins. Celinda has focused especially on women's concerns and women candidates, including Speaker Pelosi, former Governor Janet Napolitano, Senator Debbie Stabenow, former Senator Barbara Mikulski, and over a dozen women in the House and Senate. Celinda has also worked with key progressive groups, such as the AFL-CIO, Planned Parenthood, Vote Vets, Human Rights Campaign, and Emily's List. So without further ado, Celinda, thank you for being here, and we look forward to your presentation.
Well, thank you. I'm delighted to be here, and it's obviously been a struggle for all of us doing Zoom. I wish this were in person. It was such an energizing conference always, but delighted that we could find this new way to do it. And want to introduce my team as well. Alicia Snell, who's a fellow partner in the firm, Kate Gormley, who is a VP, and both of them in charge of women's issues and women's health care. So let's talk about women's health care and the elections. And if we look at the next slide, um, this is just an executive summary. By the way, you can have all of these slides. I'm not going to be monitoring the chat while I'm presenting, but feel free to bring those ideas back, and I'm sure they can be brought back by the moderator as well. So the cost of healthcare rapidly rising in America remains a top concern. Healthcare and COVID and the cost of healthcare are really top concerns for women. Well, remember that as progressive women, we won in 2018, in part fueled by the healthcare issue. And to the extent that we are going to be able to win in 2022, it will be because, probably because of the healthcare option, because of the healthcare issue. People agree that healthcare needs significant change. They're willing to consider even using, when we use the language government run program, Medicare, Medicaid, very, very popular. Most states very strongly in favor of Medicaid expansion. And even with COVID on dominating people's minds, healthcare costs is really the number one issue in people's minds. And it is a real contributor in people's minds to inflation. That includes reducing the price of prescription drugs, and notice I said price, not cost, protecting coverage for pre-existing conditions, preventing surprise billing, all very popular, all relate to cost in people's minds. And these are both turnout issues and persuasion issues. So independent women, older women who are the key for the 2022 elections, really focusing on these issues, and younger women focusing on healthcare as well, particularly for children and reproductive health care. And we have real issues right now with younger women. In fact, the data coming out of Virginia shows that we have both turnout and level of support problems with younger women becoming more swing as the election has gone on and less encouraged about turning out to vote. People want solutions. They don't want to talk about the problem. They know the problem, and they want to affirm a positive aspirational vision rather than just ameliorate harm. So often, as we start out with a long discussion of the problem, people are quite aware of the problem. What they want to know is what we're going to do about it. And we often use policies and acronyms. It's much, much stronger to talk about shared values, and I'll show you some of that messaging. In the healthcare arena, identifying a villain is very important, including identifying the insurance companies and the drug corporations. And it's always good to refer to them as corporations, which triggers people thinking more about price gouging and greed. This healthcare issue also one of the strongest answers to people's general concerns about inflation, which are dominating the economic scene right now. So this is good for progressives. It's a twofer, a policy in itself that's very popular and a policy that's popular as a way to address inflation. You mentioned mental health. Mental health, a very, very strong issue for people. And you'll see some really dramatic data on mental health that we'll show you. And then finally, reproductive health care. It soared in people's concerns right after Texas, and then it receded as people concluded, well, my state's not going to be like Texas. No one's as crazy as Texas is. My apologies to the Texas legislators who have been fighting this so hard. So it'll depend a little bit on how this issue proceeds, what people are going to conclude in terms of the salience of that issue. But it's a strong issue with younger women in particular. So let's look at some of the data, and we'll go to attitudes on healthcare. First of all, in terms of the most important problem, you can see both men and women concerned about healthcare costs and COVID-19, and that is really dominating the issue scene. And healthcare costs, again, the number one inflation concern for women. If we look at the next slide, you see here Democrats very, very focused on COVID and healthcare, independents as well, and Republicans also very focused on COVID, less focused on healthcare costs, but very, very supportive of action to get prescription drug prices down, including negotiating lower prices. They don't realize that the party has come out against that. They don't realize they're supposed to be against that. Notice that abortion much lower in the tier of concerns. And again, people still skeptical that Roe v. Wade will be overturned, but very anxious if that ends up being overturned. If we look at the next slide, we can see some differences here by age as well. And notice the over 65-year-old. They are most concerned about healthcare costs and prescription drug prices. And there's a lot in the conversation around Build Back Better, where seniors tend to think it's a good policy, but less about me. When we bring in prescription drug prices, it becomes totally about seniors, and they're very, very focused on it. And so are the voters 30 to 64, the voters who say, because I have insurance, a drug will cost me $15, but my mother or my grandmother is paying $400 for that same prescription. And that's outrageous. If we look at the next slide, you can see that women of color also very focused on COVID and very focused on healthcare costs and prescription drug prices. Looking at the next slide, people want changes in the system, although they are nervous about completely rebuilding the system, particularly in the time of COVID. People have gotten a little bit more cautious, and the language matters a lot to people. People like guaranteed and universal health care. They like Medicaid expansion. They like Medicare for all, but it depends on how you define it. Because a lot of these terms still aren't that familiar to voters. So start with a values statement, but note that people aren't necessarily that familiar with what we're talking about. And indeed, we find that it is a really hard time to break through, and you're probably finding that as a state legislator. We have we have 65 to 67% of the voters who like Build Back Better, but we have over 50% of the voters who cannot name a single component of Build Back Better, even with all the advertising, et cetera. So definition is important here, and definition in terms of quality healthcare, access to your doctor, not technical pieces, where the payment is going to come from, just the basic questions of what kind of quality care, what kind of guarantee, am I going to get to choose my doctor, how's this going to be paid for? If we look at the next slide, you can see here Democrats more change-oriented, Republicans more cautious, and independents in the middle, as you might expect. Looking at the next slide, people are very willing to have a role for government in healthcare, and this has been persistent for a while. And notice that this issue has become more partisanly polarized. In 2006, Democrats, independents, and Republicans thought the federal government needed to do more to make insurance affordable for people and available. After the fight around the ACA, this issue's become more, excuse me, partisanly polarized. And you'll notice that the Republicans dropped of a role for the federal government, but independents resembling Democrats, and Democrats unanimous in their desire for a role for the federal government in healthcare. There are lots of options, however, lots of different approaches that are very successful, and all of the approaches need some explanation to voters. If you look at the next slide, you can see here that Democrats have a big advantage on healthcare. It is our strongest issue advantage. So people think if you're going to do healthcare, Democrats in Congress or Democrats in state legislatures are going to be better. They also think that women are going to be better. So setting the agenda here is halfway toward fixing the problem and also winning elections. Talking about healthcare is a really winning issue. And remember, as a progressive woman, you're going to have a huge advantage in this conversation over your male counterparts. And remember also that the number one audience you're talking to are women. because they are the healthcare voters. In fact, healthcare is the one issue that men admit women in their lives influence their positions. There may be lots of other issues where that's true, but healthcare is the one where they admit it. Turn to the next slide, and let's look at some of the policies that are popular right now. The public continues to view ACA more popular than unpopular, but it's still polarized partisanly. And it doesn't matter very much whether you call it Obamacare or ACA, Affordable Care Act. The favorability is over 50%, but just barely over 50%. And even people who like the policy also think it needs a more affordable option and that it can be improved. They particularly want to see enhancements for seniors, and they want to see the prescription drug piece dealt with, which is going to be a constant refrain you're going to hear in this presentation. If we look at the next slide, you can see that women are more favorable toward ACA. And the most recent data, we have 56% of women favoring ACA. It's important to remind people, too, that ACA is how people got their care during COVID. That's a very popular reminder to people. If we look at the next slide, people overwhelmingly support a role for government, and notice we're using the dreaded F word here, federal government, to negotiate lower drug prices for Medicare. A couple of things here. We're saying drug prices, not drug costs. And that's because people aren't sure what the cure for cancer costs, but pricing invokes it's an arbitrary decision, price gouging, profiteering. So it has a whole schema behind it that makes people much, much more receptive to actions. Because they feel like, okay, I know the price is too high. I know it's arbitrary. It goes up overnight because some young tech CEO bought a company. It's not fair. Cost, I'm not sure what it's supposed to cost. Notice Democrats very, very strongly in favor, but even Republicans don't realize they're supposed to be against this. And half of Republicans are open to looking at prescription drug pricing in the reconciliation bill. It's actually the most popular provision. And half of Republicans are supportive or willing to look at negotiation of drug prices, even though this issue has become more partisanly polarized. Independents completely resemble Democrats on this issue. This is also a great issue for rural voters and a great issue for non who are adamant about prescription drug coverage and often don't have it. If we look at the next slide, here we can see this by various demographics. How do we use the savings in Medicare from prescription drug price negotiations? And people overwhelmingly like the idea of expanding benefits, particularly hearing, vision, and dental. That's particularly true for women voters and particularly true, notice those rural voters. Many of us are looking for things that we can talk to rural voters about. Prescription drug prices, Medicare, Medicaid, these are issues we can talk about to rural voters. In my own personal experience, I grew up on a ranch. None of us, we did not have health insurance my entire childhood. And I can remember sitting around our neighbors' kitchen tables when people turned 60, 65 and saying, well, at least Joe's going to have health care now. Lowering Medicare to people under 60, people like that policy, but they don't necessarily want to use the savings from Medicare for that policy. And seniors are concerned that it's going to make the Medicare system more crowded. So they like better to hear about a Medicare-like system than Medicare, or buying into Medicare, but at on a separate system. So a little bit more nervous about, the seniors are a little bit more nervous about how that Medicare expansion gets implemented, where expanding benefits is a no-brainer to voters. If we look at the next slide, you can see here, would you support a candidate who supported Medicare negotiation? And would you oppose a candidate who opposed it? And the answer is this is a really strong voting issue, and it's strong both as punishment and reward. We see a lot of policies right now where people will punish elected officials who are bad, but not reward elected officials who are good. And this is strong. Now, you may ask yourself, this is not particularly a state issue, but there are several things that test quite popularly for state legislators. One, just a resolution in support or coming out in favor, because people think their state legislature has to pressure the Fed. And then, depending on the state law, there are a lot of different ways that lowering prescription drug prices can be done at the state level. And you all are the policy experts, but people respond very strongly to buying drugs in Canada and bringing them down, importing them from Canada, setting up a consortium in the state where you can order your prescription drugs, and that consortium negotiating lower prices, et cetera. So there are a lot of really good options. One of the more active states on this is the comptroller, Kevin Lembo of Connecticut. And there may be some other people you would point to and look at what he's done. There's quite a bit that they've been discussing. Last thing I want to say, notice those last two numbers, the undecided about congressional vote and the low propensity Democrats, people who turn out in presidential years but don't turn out in off years. Low propensity Dems, motivated by the prescription drug price issue, and people who are undecided for Congress or, by extension, state legislature, also motivated by this issue. So it's good for the base and good for the swing. Let's look at the next slide. People like a national Medicare for All health plan. Now, again, there's a lot of different ways to talk about this, good ways and bad ways. You don't want to say single payer. You want to emphasize the care delivery, not the payment mechanism. And people, when you say single payer, people assume they are paying it all because they don't know any other payer but themselves. So they don't assume this is government financed. They assume it's individually financed. Where else would you get the money? Secondly, people like the analogy to Medicare for all. And they like a role for government. They're not as sensitive to a role for government as they once were. That is particularly true for women and particularly true for younger people. We still have some seniors who view Medicare as a private plan. They'll say things like, keep the government off my Medicare, rather than understanding it as a government plan. But that is diminishing over time, and the new baby boomers tend to have more of an understanding of that. If we look at the next slide, you can see here people like a public option as well. Frankly, they always wanted a public option, and many of us fought hard on this call for it. They always liked a public option in ACA, and they continue to like one. They don't completely understand how it would work, but they assume it would be lower cost, and they like that prospect. And they think that ACA is pretty expensive right now if you have to go it alone. Good that it has a guarantee, but pretty expensive even in the lowest cost options. If we look at the next slide, Medicare for All and public option, notice Medicare for All has become a little bit more partisanly polarized. Fox News has been hitting it hard since the 2020 presidential. But a public option, because it's been less in the public eye, not as partisanly polarized. And 56% of Republicans say I'm in favor of it, not realizing they're supposed to be against it. And it's thanks to their folks that we don't have one. So really interesting in how the Fox News and the social media really influences how Republicans see these issues. And when things are out of the news, Republicans bounce up and are very, very supportive of a lot of the policies we all would support on this Zoom. If we look at the next slide, what do people want? Well, people like a lot of different proposals, but they are also not very well understood. They also assume that there would be no role for private insurance, and people feel mixed about that. They like the private insurance as kind of a fallback mechanism. They assume their taxes would increase. And if you are doing something where you are using increasing taxes on the wealthy or businesses who have not paid, very, very important to emphasize that mechanism. Very important to say who you consider wealthy. We did a fun experiment where we asked people, what do you think is wealthy? And people said 150,000. And then we asked people, well, the Democrats are in charge of this. wealthy, and they said 250,000. And we said to them, wait a minute, you just said 150,000. And they said, yeah, but they're the Democrats, so I'm worried that they're going to come down and get me. So in the national plan, it's been very, very important to say 400,000. It's also very powerful to point out the number of corporations who aren't paying taxes, profitable corporations like Amazon and Netflix and Google. It's also very powerful to say closing tax loopholes. That's something that's very, very popular with the voters. And they think that the corporations are constantly in there lobbying to get loopholes for themselves, which of course they are. Also very powerful if you're selling Medicare for All to say that people will no longer have to pay deductibles, copays, or premiums. That's a positive price side on our end. So lots of different things here, but noticeable that you've got to provide some explanation. And we're not using a lot of acronyms here. We're not using a lot of numbers. We're just trying to set the basic, what kind of quality do I have? What kind of guarantee do I have? Who's paying for it, and can I see my own doctor? Next slide. Notice that people, this showing the confusion about what a public option entails and what distinctions there are between a public option and a Medicare for All. In general, the public option is just assumed to be better on everything. It's not that people really understand what it will do. And you can see that popularity really factoring in when it's option, people assume they could keep their own plan. And when it's option, people assume that employers are contributing as well. When it's Medicare for All, they're not as sure that those are pieces of the pie. One of the things that's very, very important here is people used to not be aware at all about what their employers were contributing. Now their employers have made darn sure that their employees know what they're paying for health care. Most employers report to their employees now what they paid for health care in the last year. So people are worried about losing that major contribution. Looking at the next slide, what are women's attitudes about healthcare and women's healthcare in particular? Well, women care more about healthcare, just period. The dark blue lines here are men, the light blue lines are women. And women are just more focused on healthcare. Women also tend to see healthcare as more of an economic than men do. If we look at the next slide, people are very, very focused. Women are very focused on mental health. Notice 64% of women during COVID say they personally have experienced a mental health challenge. It's huge out there. The other group that's really, really big on mental health is millennials and the younger voters. They're very conscious of mental health issues and have been from the get-go. And so what we're finding is no matter what policy you're talking about, whether it's criminal justice, whether it's police reform, whether it's healthcare, whether it's education, including mental health is a very strong component in all of these policies, particularly with women and particularly with millennials and younger. If we look at the next slide, people are worried that their healthcare costs are going up. And about a third of people have some kind of health cost right now that they are struggling with. Women more worried than men. And again, women are the drivers on the healthcare issue, and women see dealing with healthcare costs, cheaper ACA option, getting prescription drug prices down as major, major contributions to leading to dealing with inflation, period. If you look at the next slide, when women were asked how much of an impact aspects of the American Rescue Plan will have on them and their family, all of the issues related to healthcare were really strong with women. It was very salient to them. Health insurance expanded, health insurance premiums being lowered, and investing in mental health. All of those were really, really strong for them, and particularly for women of color. Notice those numbers to the right among African American and Latinas. Very, very strong on healthcare issues. So this is a persuasion and a mobilization issue for women. If we look at the next slide, When women were asked how much of an impact these issues would have on the lives of women themselves, they were very strong. And again, lowering health insurance premiums, expanding health care coverage, two of the biggest issues out there. And again, extra salience with women of color. This is really shaping up to be like 2018. But the difference is in 2018, we were talking a lot about healthcare, led by our women candidates. And now we're talking less about it, and we should be talking more. So this is a win-win issue for you. If we look at the next slide, how should women champion healthcare issues? Well, first of all, just know that you have enormous credibility and you have a ready-made audience. And that's true whether you're talking about it or talking about what the president should be focused on, or Congress, or your state legislature, or your governor. Everybody women really prioritize the issue, and women really believe that women office holders will prioritize this issue much more than men. If we look at the next slide, thank you. But also agree very strongly that we need to invest more in healthcare. COVID-19 has really heightened women's belief that we need more healthcare investment, whether you're talking about Medicare, Medicaid, ACA. The Medicaid numbers are up in states, and not just in liberal states. Expansion Medicare is up. The popularity of it is up in places like Montana, Missouri, North Carolina, and it's women voters who are leading this. Men are like, no, we got to cut costs of everything. Women are like, no, we need more investment. We just saw why we needed it. And by the way, do what I tell you on this issue. If we look at the next slide, the biggest motivators for women are COVID and the economy. And the strongest economic message for women includes an explicit message of healthcare. So, as progressives, one of the things we're weak on right now is the economy. And we never win elections when we're not tied, at least on the economy. And we're weaker on prosperity. We're 9 points behind the Republicans and conservatives. We're behind on the economy right now. When you add healthcare to the economic message of jobs and wages, you increase significantly the credibility of progressives and Democrats. And women candidates, again, are the single most credible spokespeople on this issue, and linked to providers as well. If we look at the next slide, this just shows you the issue advantages that Democratic women have. We're 9 points behind on taxes, 11 points behind on the economy, Republican women behind on the economy as well, but we're 34 points ahead on education and 31 points ahead on healthcare. So again, we're not talking about a trivial advantage here. We're talking about a major, major advantage here. If we look at the next slide, women's health care. Women's health issues are strong to women voters. They're not convinced that abortion is threatened, but they give women candidates, particularly Democratic women candidates, total credibility on women's health, birth control and contraception, and abortion. And by the way, the affordability and availability of birth control and contraception, very, very strong issue for those younger progressive women who are less likely to turn out right now. If we look at the next slide, what are the messages? What are the words to use that are particularly powerful? First of all, people have the light blue is negative, the dark blue is positive. They like universal health care. They like Medicare for all. They like national health plan. More nervous about national single payer health insurance because they don't love insurance. They love health care. And they're worried the only single payer themselves. Socialized medicine is dividing. Now, on the one hand, to be half positive, half negative is pretty darn astounding on socialized medicine. But people are nervous about socialism. And that's true, even though 50% of voters, by the way, say, I don't know what socialism is. But 2/3 of voters say they don't like socialism. And 44% say they don't like socialized medicine. It's pretty easy to turn back the socialized medicine attack and say, this is just a political attack. It doesn't even mean anything. What we're talking about is, and then go into your plan and building on the existing system and improving what we have now. And that it's actually quite easy to turn around the socialized medicine attack, even though it's out there and even though they're prompting it a lot in social media. If we look at the next slide, people are fine with eliminating private insurance as long as they can keep their choice of providers. They're really nervous that eliminating insurance means that we are eliminating their choice of providers as well. Um, Requiring more in taxes, people want to know who's going to increase. They're very, very nervous about being guaranteed that it's not them. Because remember, 80% of people thought their taxes would go up both for the public option and Medicare for all. Increasing the taxes that you personally pay, well, it's actually pretty amazing that we can get 47% of the people in favor of that if it reduces their healthcare costs. But it's people think that money is tight right now, and it's pretty important to say who's going to be paying the increased taxes. So we're going to close loopholes, that we're going to save money with negotiating prescription drug prices, that we're going to tax the people who aren't paying their fair share, the people or what they owe, the people with loopholes, the people over 400,000, 200,000, whatever it is. If we look at the next slide, what are the language recommendations? We want to tell people what they're going to get. People are sick and tired of hearing about the problem. They know the problem. They want to know what you're going to do about it. We want to get to include, to the extent you can, lowering the price of prescription drugs. And even if you have nothing to say about that at the state level, saying that you sent the members of Congress a letter to say it's included, that you took a vote in the state legislature to say it needs to be included. And of course, now is a very timely time to do that. Talking about the for-profit healthcare insurance and for-profit healthcare industry. That is a good villain, and it also makes people think you're not talking about our Catholic or public hospital, you're not talking about my doctor. People want, women in particular, want reassurance that the doctors and hospitals they've chosen are going to be in network. People really love vision and mental health. They love the term guaranteed health care. And guaranteed, by the way, tests better than government. They know that if it's going to be guaranteed, the government has to play a role, but they like guaranteed better. And then talking about the cost of health care. People are very upset about the cost of health care, the cost of insurance, the prices of prescription drugs. If we look at the next slide, prescription drugs better than pharmaceutical drugs. Drug corporations and CEOs better than drug companies. Prices, we've talked about that, better than cost. You can refer to monopolies, by the way. People are increasingly believing that the pharmaceutical industry and that healthcare in general is increasingly becoming a monopoly. People like the language price gouging. Life and health should not be up for sale. Don't put life and health before greed, and that pharmaceutical corporations, insurance companies don't put life and health before greed and profits, and that they are right now spending millions on lobbying to make sure that we don't get what we need and what you obviously are fighting for. Next slide, and we're done. So love to, that was a very quick tour of the landscape, I know. You will definitely have access to all of those slides, but love to get your questions, your comments, your experience, and other data that you've seen for the remaining amount of time that we have. I don't know how we're dealing with the questions. There you are.
Yeah, thank you so much for that presentation. I learned a ton. I always learn a ton every time I hear you present. The Q&A function off to the right is where we would have questions. I'm not seeing any in there now, but earlier, as I mentioned, we had talked about, and you mentioned this a little bit, reproductive health access being top of mind, and then just the comment about mental health. So can we talk a little bit about messaging, or sort of pull that thread around the mental health care?
Yes. So basically, it's really interesting and really good mental health doesn't need a ton of messaging. It needs a ton of inclusion. People have a pretty good sense of it. And I'm sure they don't know the details on who's providing, but nobody questions, like, there used to be a time when mental health, people were wondering, is that real? Is that a disease? And then Tipper Gore and Rosalind Carter and others got involved, and people came to see mental health as a disease of the brain, or a disease, not. And so they've been pretty supportive of that for a long time. What COVID and even the pre-COVID era did was dramatically increase people's awareness of mental health, their own feelings of experiencing it, and their connection of it to everything that's going on. So now, where people were supportive of it, now it's like checking the box, honestly. People want to invest money in it. They want to see it included in all kinds of programs. Even people that, in the whole defund the police fight, which is a whole nother conversation, or I should say so-called defund the police, the strongest argument on our side is actually we need public safety. That yes, there are situations where we need police, but there are other situations where we need a mental health worker, we need a social worker, we need a violence intervention. And I can tell you, we're just finishing up some work on education. The three new things that people think that education needs, based on what they've experienced during COVID and the learning loss: personalized learning, high-speed internet, which by the way tastes better than broadband, and mental health. So we just need to start really pushing it in. And we're not on nearly the defense that we used to be, like having to define what it was, seeing it as an open-ended expenditure, seeing it as a fake disease. People are like, oh, that's crazy ass stuff. I mean, hopefully your opponent would use that kind of language, because people are like, are you kidding me?
Thank you so much for commenting on that. I had to chuckle there. I hate to cut you short. We do have another session starting right in this main stage, so I want to give time just to say thank you to
So
you.
much.
And thank you for joining. Thank you to the legislators for your patience and grace as we worked through our tech issues. And Celinda, as always, thank you. And we can get the slide deck, and we'll include that in the resources tab for our folks.
And if people have questions, feel free to contact us either through Rikia or Juan. Will give you our number. Thank you so much for everything that you all do. I apologize for being late with the technology, and of course, a woman technologist got me through it all.
Yeah, of course.
Great to see you, and have a great rest of conference. Thank you so
Thank
much for
you.